We have some questions that were submitted beforehand, and I'm just going to put them to the panel, and also to let you know that the Q&A option is open on the WebEx. So if you want to submit any questions, we'll take them live as well. But just to kick off, we'll start off with some questions that have been already submitted. So the first question I have is from Maura in Ennis, and Maura wants to know, is there any plan to install electric vehicle chargers for staff in any of the hospital sites?
Yeah, that's something that estates are looking. Thank you for that question, because I think that's a lot of people are interested in the response to that. So yes, estates are looking at that. In fact, in Croom and Nina, we already have charging points, and they are looking at increasing those in the other sites. I suppose the main thing is that though people will still have to pay, the charges, because they'll probably be provided by an external provider, but the estates are looking at that at the moment for certain. Yeah.
Okay. I have another question that's come from Ennis as well, from Ellen in Ennis around the Ennis Theatre. At what stage, there's a few elements to this question actually. So at what stage is the design team at, and when will the stakeholders see the draft drawings, and when will they have input?
Okay, so we're at early stages of the theatres in Ennis, and the architect has been appointed, and it's just at design stage. User reps, I understand, have already been identified, and they have visited with the architect the theatres in Nina and in Croom. And once the drawings are done, those user reps then can share widely with their colleagues. Hopefully they're going to go for planning before the end of the year. But stakeholder input is going to be really important.
Okay. I have a couple of follow-on questions from that. From sanctioning the design, how long will it take to start the completion of builds?
I don't have the outline. I suppose until they do the design, usually when they'll come back to us then with the full programme. Oh, okay. But they're at a very early stage. Yes. Okay. Yeah.
Have the rising cost of building materials been factored into the budget? On average, building costs have increased by 40 to 46%, this person says here. And will there be contingency financial planning to cover the extra costs?
Yes, so I suppose there'll be an uplift of costs in line with inflation, and estates are very aware of that, and that's true for every project in the capital programme. So that's something that estates are dealing with at the moment.
Okay.
Yeah.
And I just have a follow-on question here, but I'm not sure it's necessarily linked to the build. Will UL Hospitals Group, in conjunction with UL, be running a theatre course?
That's something that we can discuss with the chief nurse. I don't know what the plans are in relation to that, but that's something we can come back on. Okay. Yeah, definitely. Yeah.
Okay. Staff are aware that a national policy is due to be issued, but is there any time frame for when this policy is due to be released so that staff can apply?
Sure.
And then a secondary area, there are lots of areas within the HSE are operating a working from home policy without the national policy.
Sure.
Staff are seeking to have something similar rolled out in their areas.
I mean, interesting enough, it came out within the findings of our staff survey where people are certainly identifying that as, something that they want. And unfortunately, we do need to wait for the national policy because that will, I suppose, guide us and steer us. And I suppose that's something that we would be talking to our union colleagues with as well. But I know that there is areas where people are doing remote working. So I suppose it is incumbent on staff to, talk to their line manager about that to seek their guidance and advice. But we are awaiting that policy, and in the meantime, and it's something that we do want to embrace going forward.
Okay, thanks, Lorraine. We're just starting to get some questions in, so just a reminder that the question function is available there, and we've just got a question from Joe in Ennis. Any update with the health and safety officer for the Model 2 sites?
Yeah, so I think I've already been in discussion with Joe about that. So there, on each of the sites, there is a health and safety committee, and then there's an overarching health and safety committee on the UHL site. John Doyle is the health and safety lead for the group. And I think that any, change in the governance arrangements or any additional staffing would need to come through John Doyle in the first instance. So I would advise maybe the sites to do that in the first place, and then submission will be made to the executive management team following that.
Thanks, Noreen. Lorraine, I'm going to come back to you in relation to reduced hours.
Yeah.
So is there any circular or memo issued in respect of the restoration of the hours to the pre-Haddington Road agreement? What are managers to advise staff? There's been lots of talk in the media that this is effective from the 1st of July, which is just a little over a month away, and staff have received no formal notification. Is a communication going to issue to staff and managers that are impacted?
So we did issue out communications to managers on the reversal of hours under the Haddington Road. So it doesn't apply to all grades of staff, but it certainly applies to nursing and midwifery, health and social care professionals, and management and admin grades. So we were doing an exercise in terms of identifying what we need to do in terms of preparing for that change and that reversal of those hours. So again, there is a frequently asked questions document that we can communicate out to staff. But one of the important things is that from a backroom perspective in terms of the SAP system, on the 1st of July, there will be changes in the background to people's weekly, hourly contracted hours, but that will not affect people's pay. And again, I suppose it's incumbent on each area to, link in with their line manager in relation to that and what that will look like. It will have an effect on 24/7 hour rosters. In other areas, in clerical admin areas, it will have an impact as well.
Okay. Lorraine, I'm going to come back to you in relation to pandemic special recognition payments.
Yes, sure.
How will I know if I've been identified for the special recognition payments? And is there any obligation on line managers to inform staff whether they have been, whether they're entitled to that payment?
Yeah, sure. So we had issued communication to line managers and to staff a couple of weeks ago in relation to those staff that are eligible for the pandemic award payment. So unfortunately, not all staff are entitled to it under the terms of the circular. And the circular is a national circular that was issued from, I suppose, ultimately the Department of Health that came down to the HSE. So we are mindful that it has caused, I suppose, some concern among certain groups of staff that feel that perhaps they should be entitled to it. So what I would be saying is that staff need to link in with their line managers in terms of validating whether they're eligible or not. And if there is staff that feel very aggrieved about, not receiving it, then I would ask the line managers to escalate it up to us in HR, and we are awaiting an appeals process from the national system about, those areas where people feel that they should be receiving the award. But it is quite specific in terms of, it is very much around frontline staff that are to receive it. It's based on the sequencing in 1 and 2 back in when we were vaccinating our staff. So yeah, it's very clear. And I think as well, we might recirculate the FAQ document on that perhaps maybe next week.
Yeah. Okay.